It is important that you know what food to give to your toddler when they have the diarrhea. Does your toddler have acute gastroenteritis or a stomach infection where he or she has vomiting, diarrhea, maybe a fever? Or does your kid have the toddler's diarrhea as diagnosed by your doctor? Well, it is important that you know what food to give to your child, what foods to avoid, what medications are okay to give, and how to restore proper nutrition on your kiddo. We will talk about these things in this video. Hey, I'm Dr. Kristine Alba Kiat, and I'm a board-certified pediatrician. And my mission is to help you moms and dads to empower you to raise happy and healthy kids. Toddler's diarrhea is a non-specific form of diarrhea commonly seen in kids who are 6 months to 5 years old, more commonly in 2 to 4-year-old kiddos. The poop is composed of stool that is loose, watery, and frequent, about 3 times a day. The poop can be yellowish, greenish, or brownish in color and can also contain undigested food. The kid does not complain of belly pain, there's no vomiting, and no weight loss. But what is the cause? Well, food and fluid move quickly through the intestine, therefore there is less time for absorption. It is also characterized by loose and explosive stool and some gassiness. If your child is a picky eater whose diet is high in sugar, this also contributes to the toddler's diarrhea. Have you heard about the BRAD diet? BRAD diet stands for bananas, rice, applesauce, and toast. That is all we give to the child who was once recovering from diarrhea. But this is no longer useful. This is because just the BRAD diet is low in fiber, low in protein, low in fat, and it lacks the nutrition to help the GI tract recover. In fact, some pediatricians believe it may make the diarrhea last longer. What is advisable now is a mix of fruits, vegetables, meat, yogurt, and complex carbohydrates. What I would recommend is a well-rounded, nutritious diet for your toddler with a diarrhea. Let's discuss each of the components. Bananas are helpful because they are high in potassium for electrolyte balance, they're easily digestible, and they soothe an upset stomach. Rice acts as a binding agent, gives your child energy, it is easily digestible and gentle on your kid's tummy. Applesauce, well, it has pectin for stool consistency and provides vitamins as well. While toast is a source of carbohydrates, and it also absorbs excess stomach fluid. While each of the components of the BRAD diet are helpful, you just have to mix it with a variety of other fruits, vegetables, meat, yogurt, and other complex carbohydrates. The most important thing to give to your child who has diarrhea is to maintain his or her hydration during diarrhea. This is by offering clear liquids and an oral rehydration solution. When your child has a mild diarrhea, it is not necessary to give an electrolyte solution, but an electrolyte solution becomes important in the home management of a child with moderately severe diarrhea. An oral rehydration solution is a specialized fluid designed to replace water and salt that is lost during the diarrhea. It is not advisable to give soda, juice, or sports drink, as they have the wrong amounts of sugar and salt and might actually make your child sicker. What foods to avoid when your toddler has diarrhea? Well, do not give fatty, greasy, and spicy foods. Also avoid sugary foods and drinks. Then what about antidiarrheal medicines? Antidiarrheal medicines are not recommended for kids who are 2 years old and younger, and they might be harmful for older kids as well. I recommend you always check with your doctor if what medicine you can give for your child with a diarrhea. Then what about probiotics? Probiotics are good and important in restoring the gut flora. It is good to introduce it for your child's gut health. Yogurt, for example, has good bacteria. There are also some types of infectious diarrhea where probiotics might be helpful. It is important that you check with your doctor, though, before using them. You can buy probiotics over the counter, and they're available in liquid and pill form. Now, how to restore regular diet on your child? Well, we gradually introduce regular food to your kid. Just monitor his or her bowel movement as well as the tolerance. But when the diarrhea persists, you should let your pediatrician know about it. And it is important that you call the pediatrician when your child's diarrhea is accompanied by fever for more than 1 to 2 days. There is bloody diarrhea when your kid has vomiting for more than 12 to 24 hours, has a swollen belly, would not eat or would not drink anything, when there is severe belly pain, or when the diarrhea is accompanied by a rash or jaundice or the yellowish discoloration of the skin. The key thing to remember when your toddler has a diarrhea is that it is important to maintain proper nutrition and hydration on your child. And you should seek consult from your doctor whenever necessary. To reduce your child's risk of getting the diarrhea, first, we should stop germs from spreading, so it is important to wash hands frequently. Also, avoid giving raw milk or food to your kid. Do not give antibiotics unless they are necessary. It is advisable and highly encouraged to breastfeed your child. Limit juices. And lastly, give your child the rotavirus vaccine. Hey, if you like this video, watch my next video where I teach you about other child health problems.